So, hello everyone. I'm glad you are back to the lecture of the study course named Kinesiology of Musculoskeletal System. Today, our topic is elbow complex and wrist complex. So, both in together to understand how a whole upper extremity working together in combination with the shoulder topic we discussed the last time. And I would like to start with the elbow complex, which is located more proximal to the shoulder. So, talking about the elbow joint, in my opinion, it's one of the most functionally important joints as well as also Professor Wall Jones, who is clinician physiotherapist working at Chapel Shoulder and Elbow Unit, which is also the head of the European Society for Shoulder and Elbow Rehabilitation. So, really smart and experienced elbow specialist I got to learn from, said that elbow usually is unforgiving and as well as underrated joint at the same time. So we are used to talk a lot about shoulder and its function. Meanwhile, what's going to happen if you lose your elbow for any reason? You even won't be able to eat food independently. So probably one of the most important joints in the context of upper limb, especially. And I think understanding it better may help us to train it better to deal with the elbow joint a little bit better. And once again, let's get started with a quick anatomy review. So we need to take into account that our elbow complex consists of humerus, a distal humerus part, as well as both radius and ulna, so two forearm bones here. So here on the left side, you can see actually ulna with its olecranon process and cochlear notch that actually fits really well into this trochlea that you can see in the middle to make the humeral ulnar joint in this case. And we have also capitulum where the radius articulates with the humerus as well. So actually it's a complex joint because we have also one joint in between the radius and ulna called proximal ulnar joint. We're going to discuss later on as well during this presentation. But basically, what you need to keep in mind that the structure, ulna together with trochlea allows for the hinge-like motion of the elbow joint while providing attachment points for muscles and protecting important nerves here. So even if you get any minor trauma, any unsevere trauma in your opinion, make sure you don't have any innervation issues in your wrist distally as well as in the elbow around the elbow region, because as soon as it's really important joint in context of nerves, they also may be impaired during any elbow trauma. But probably there are topics that are more important than trauma by itself, because in healthy people, we just know that humerus actually, with its important distal part, is really important for a few reasons. First of all, what we can see on the left picture is the same joint surfaces we already discussed, as well as some muscle attachment here. We'll need later on, which is the common extensor supinator and flexor major tendon attachment points on both sides of the joint. So we have two condyles with their attachments at the bottom of the bone on each picture that you can see here, as well as we have this brachialis muscle on the left. You can see its attachment point on the humerus. It's the main flexors in the biceps. We sometimes think actually the main function of the brachialis is to be agonist, while the main muscle that the bends elbow. So biceps is just its synergist in this case, and it has few more functions. Take a look at, for example, supination or the flexion of the shoulder. And as well as keep in mind that there is a brachia radialis attachment. You can see here on the right side once again on the lateral edge of the distal humerus. And it also play its role in the elbow movements that we can discuss later on. So remember these attachment points. They're really important in this case. And also I have mentioned a few structures that are really important in the case of the elbow joint. So we have capitulum here. Once again, you can see the surface that articulates with the radius. We have trochlea. Once again, we discussed already that articulates with ulna, as well as olecranon fossa, which is kind of extension stabilizer. So this fossa actually limits the extension. And for this reason, we are not able to hyperextend the elbow talking about our forearm bones, both radius and ulna. You can see here on both sides, more important structures, or the most important structures, I should say here, is the head of the radius. You can see it on both sides. The head, it's actually the surface that articulates with the capitulum, as well as we have this capsule line shown on both sides at the top of the bones here, which is actually a capsule that contains three joints we're going to discuss during the arthropology section here. We have also like proximal and distal radial articulations shown here. What's really cool about this, it's not just a bunch of bones and muscles sitting there looking pregnant. It's a brilliant piece of evolutionary engineering at some point, because actually both of these bones are interconnected with distal and the proximal or upper and lower radiolar joints. And there is also interosseous membrane. You can see these during this picture. We're going to discuss about its function later on as well. But in general, it's like a natural suspension between radius and ulna, as well as, once again, some flexor and extensor muscle attachments we can see on these bones is really important. But don't take them seriously in just anatomical way. It's not about isolating these structures or knowing its exact attachment point, because your forearm is like a really complicated machine where everything works together. So when you're grabbing your team that or doing a bicep curl, it's not just one muscle doing all the work. It's just a whole beautiful orchestra of tissue playing together. So for this reason, it's better to see how functional elbow are and what we can do in context of muscle groups, not just particular muscles. Obviously, for some people involved in neurological medicine, it's really important to understand which muscles perform their individual function. But if you are just a person who participates in sport or trying to understand what you need to train, that are focused on just having training process for these muscles as groups, not as particular isolated muscles, because we're not going to discuss these structures from medical perspective. It's more or just how they're built in order to function well. That's why we're going to discuss now a new called carrying angle of the elbow. It's one of the fascinating aspects of the elbow biomechanics. So carrying angle is longus or Barter's angle between the axis of humerus and ulna. You can see here. So the axis of humerus as well as the axis of ulna are shown here with lines. And it's a brilliant example of our body's structural adaptation. It's essentially the angle between the humerus and the ulnar axis. And what is particularly interesting is how it changes during the movements. During flexion extension, the ulna actually deviates laterally relative to the humerus, especially during the extension, and that's our normal cubitus valgus. The average value is about 13 degrees, give or take 6 degrees, so it could be different in different people. And now it's get really interesting. There's actually a gender difference of women typically have about 2 degrees more valgus than men, and for each sport, a specific people for athletes, while non-athletic population show over 90% symmetry between sides with no pathology, then athletes don't follow these rules. What we can see in athletes is that dominant hand is completely letting them solve for different degrees as a natural adaptation to movements within everyday sport. So, and then showing activities, enhancements, and so on, radix as well. Initially, we need to be aware of two important thresholds. Excessive load is considering anything over 20 to 25 at least. Acute virus for the ulna it's medially by more than 5 degrees, it's considered reduced. So high acute virus, as I said, this really means us to seeing people with these angles that we need to check for underlying history of trauma or any other disease, which means avoiding them might be different of what we assume actually the patient when it happened in a different way that in a normal sport science And isn't just academic. Understanding these angles is crucial for assessing elbow function and injury risk as well in both sport specific and clinical practice. So I would recommend you to observe these theoretical angles, even though the Roman sports they are not so symmetrical. It still may say us that something is not really normal and elbow without any specific knowledge about angle anatomy. So make sure you check this thing and then you can go further